Skin cancer is the most common type of cancer. 1 in 3 cancers diagnosed is skin cancer. It is also the most preventable one. 80,000 cases of skin cancer are reported each year, 5,000 of which are melanoma. The deadliest form is skin cancer, which forms in the melanocytes, the cells that produce color in the skin. The most common types of non-melanoma skin cancers include basal and squamous cell carcinomas, which we'll go into more detail later. Skin cancer was first discovered in the early 1800s by a French physician, René Laennec. He described the black tumors as an autonomous disease, now known as melanoma. Basal and squamous cell carcinomas were discovered in 1827 and 1912, respectively. Between the 19th and 20th century, medical scientists demonstrated that skin cancer was caused by UV radiation. They also proved that certain chemicals could protect the skin from radiation, which was later used in 1928 to create the first sunscreen. Thus, skin cancer is very preventable. Around 80 to 90% of skin cancer is caused by ultraviolet radiation, such as the use of tanning beds or sun exposure. However, genetics does also play a small role. The FAMM syndrome, also known as the familial atypical mole melanoma syndrome, may occur from a mutation on chromosome 9, also known as a P16 mutation. This mutation is present in up to 40% of melanoma in the family. P16 mutations cause unregulated cell growth and results in an increased risk of contracting melanoma as well as pancreatic cancer. There are also some other factors that increase the chance of developing skin cancer. Lighter skin tones are on average more likely to develop skin cancer, especially those who get sunburned instead of tan. Males are typically more likely to acquire skin cancer, though this is not related to genetics. Lastly, other conditions may increase the risk or accelerate skin cancers, such as xeroderma pigmentosum, a genetic disease that hinders the skin in repairing UV damage, which increases the risk of developing skin cancer. Other conditions include a weakened immune system or other types of cancer. Skin cancer affects the skin cells, and depending on the type of skin cancer, different types of cells are affected. As the name suggests, basal cell carcinoma develops in the basal cells in the top layer of the skin. It may appear as a shiny translucent bump on the skin that does not heal. Squamous cell carcinoma begins in the squamous cells, also found in the upper layer of the skin. It appears as a crusty area of skin or a bump, and can occur anywhere in the body, just as the parts that are exposed to the sun. Finally, as mentioned previously, melanoma develops in the cells that produce pigment in the skin, namely moles. A mnemonic for determining if a mole may be a sign of melanoma is ABCDE. Skin cancer is most commonly found in countries with a predominantly Caucasian population, as their lighter skin tones are especially sensitive to the sun. Skin cancer is much less common in countries such as those in Africa, where the skin color is usually darker. However, this also means that they are not diagnosed as early and can thus be much deadlier. Here is a graph of the life expectancy for those who have skin cancer. There are currently a few ways to alleviate skin cancer. The first being Mohs surgery. It attempts to remove a tumor bit by bit until the cancer is removed. It tries to remove the cancer and leave as much healthy tissues as possible. Another method is photodynamic therapy, a treatment that uses a drug called a photosensitizer. It produces a form of oxygen that kills nearby cells when exposed to light with a certain wavelength. Finally, curettage and electrodesiccation, also known as CNE, is used to treat low-risk tumors. They do this by scraping away the cancerous tissue and destroying the remaining cancer cells with the electric needle. This method is cheap, easy, and can be used to treat several tumors at a time. Along with traditional cancer research, a vaccine for melanoma is in development. Here are some interesting facts about skin cancer. Tanning beds are one of the most dangerous causes of skin cancer. It can double or even triple the likelihood of developing certain types of skin cancer, even when used occasionally. Sunburns and suntans are the result to damage in skin cells, which can lead to precancerous skin conditions or premature aging. When detected early, there is a 95% cure rate, so make sure to have skin exams regularly and consult a doctor if any unusual skin conditions occur.